Covered earlier in the month Dr. Barbara Ferrer, LA County health director, and how she had told everyone that schools will be going back on November 4th. But we're supposed to totally not think the CV is political. And then I watched Andrew Cuomo do his press conference a little while ago, back when he said he was going to arrest any gathering, it didn't matter who it was, for religious reasons. The other thing that he announced during that time period was that schools would be going back November 4th. I just now heard locally where I live that the schools here will be going back to school on November 4th. If none of this is political, then what the heck is going on? Why would you think that? How? Because these people, they simultaneously say that during the flu season, when flu season comes on, it's going to make this whole situation much more complex and complicated and scary, right? But at the same time, they're going to put kids back to school in November. Makes no sense. And it got me thinking. I was thinking about my first video that got removed from YouTube. That video, I was covering Elmhurst Hospital and this doctor right here. She had videoed a spot for the New York Times in it claiming that they were short on ventilators and Elmhurst was a war zone, this type of stuff. So I went looking into her and I found out some things about her. Now, I have to be very careful here because they didn't tell me what I had my video pulled for. But I just want to show you a few seconds of what I was talking about, because as Cuomo tries to bring New York down into another lockdown, I can't help but to feel even more now than ever that I was right about the whole situation up at Elmhurst. It stunk to high heaven, along with the articles covering Hart Island. Her bio: she has a focus in medical education and simulation, having completed simulation fellowship at NYU Bellevue. So she specializes in running simulation events. And she's done actual white paper on running mass casualty incidences. She calls herself on LinkedIn a resuscitationista with interests in simulation. Over on Twitter, she's a simulationista. And what is probably the most annoying thing about this whole situation. So when I read today that the WHO is backing away from lockdowns, I wasn't nearly as surprised as I think the average person would be to hear this. The people who I have heard talking about it are saying that the WHO, because Trump cut funding, is attempting to get back into his good graces. But I don't think that that's it. If we look at the examples I gave of the schools earlier in the episode, all the schools are going back on November 4th. What I see this as is the WHO is making the pivot back to some sort of normality. The globalist plan is to install Biden, and once Biden is president, to shift the perception to make it seem like there is so much progress all of a sudden being made on the CV and on other various things. They kind of have to start turning the ship early. And that's all this is. It's a pivot. The WHO wants a return to normality in November, just like the schools. And so they're coming out with a policy shift or a subject matter pivot that's going to turn them back towards what they wish to be the new normal. Notice that they start this pivoting before the vax is out. This means that the narrative shift is beginning. So even if you have tons and tons of friends that are plugged in, it shows you that this information will trickle down to them eventually. For instance, your average person with TDS, they will put stock into what the WHO says. Not into what President Trump says, but they will put stock into what the WHO says, especially since Trump pulled their funding. So now we're seeing the WHO is pivoting to move back to some kind of normalcy. It no longer supports the full lockdown measures, the draconian lockdown measures. Something that's going to turn out to be absolutely horrible is that not only has the policy been more detrimental to humanity than the virus was, but it's going to turn out that it really didn't help that much. It really didn't even correctly address the CV. And that's going to make it twice as hard to deal with the numbers when they start coming in. The addiction numbers, the suicide numbers, the drug overdoses, the abuse, unreported abuse. When all this stuff starts coming in, it's going to be even more brutal because the lockdowns weren't even extraordinarily effective. Something that's really hard to swallow in the research as the white paper continues to come out about the CV is that the number one corollary between having hit hard and having a relatively easy experience with the CV is the relative health and age of the population. Something that is going to be very difficult for Americans, especially Americans who see the Matrix version of this disease. Something very difficult for them to accept is going to be the reason why the U.S. has so many fatalities. It's because of ourselves. It's because we're not healthy. People in the Western world are obese. They have diabetes. That's why a disease that affects people with 2 or 3 or more comorbidities is hitting the inner cities in America so hard. But the corollaries between obesity far surpass those of not doing lockdown measures. Something very interesting, though, is, and we covered this very early on in the channel, we did some early research and came across some white paper that was supporting the idea that nicotine users were not getting it as much. That's actually seemed to hold up fairly well. The same receptors that nicotine uses, that your body connects to nicotine with, is the same receptors that it uses to bind to our cells, the virus, and so therefore it's just serves like a prophylactic use. And there's actually research behind this now. And they started noticing that an unbelievably small amount of smokers were getting this lung virus. So is the WHO trying to get back in Trump's good graces? No. Trump is their enemy, and that is clear. Tedros has made that clear many times, and we've gone over Tedros too. They are making a pivot in policy back to normalcy. They're counting on the globalists succeeding. Right now, isn't this crazy? Think about this. Trump pulled the funding from the WHO, so do you know who the number one funder is? Bill Gates. No, not a nation. Nope, Bill Gates. He was the number 2 funder to the WHO. So when we pulled our funding, it's now Bill Gates, the country of Bill Gates, that funds the WHO primarily.
Entirely like Taiwan, New Zealand, Australia, they took their experience and actually prepared, and so they moved a lot faster. So we, we'll have to prepare for the next one. That, I'd say is will get attention this time.
We'll have to prepare for the next one. That will get attention this time.
And so the things that you're seeing coming out of the WHO are basically Bill Gates. And it was that way before. It's just China and Bill Gates. So this guy, Dr. David Nabarro, the World Health Organization's special envoy on the CV and professor at global health at Imperial College in London, is the guy who made these comments. The WHO really do not want lockdown to be used as a means of dealing with CV unless things are really bad. Sometimes lockdown can be useful to give you time when you are working out what to do. What we're encouraging all countries to do is to build up their capacity to defend against this virus, which means picking up cases quickly and responding locally with very targeted measures. And here's the pivot. So we're not going to be doing long-term lockdowns, right? But they want the United States and the rest of the world to get used to periodic local lockdowns because of contact tracing. This is the pivot. So don't expect us to ever close your whole country again. But do expect, once a year for contact tracing teams to come through and tell you you're not allowed to leave your house for 2 weeks. And this was part of their roadmap. A new CV alert system will introduce local lockdowns based on the level of infections in a county or region. Dr. Nabarro said, "I love this system that you are developing in Ireland because you're really breaking it down to the county level, and that's what we're encouraging everywhere. You are developing a graded system, so if things are bad, you can move to level 5 and then you can come out of it as quickly as possible. I think having that capacity to shift and adapt is what's absolutely necessary at this time. We have to defend against this virus because we have no alternative, but we also have to keep life going. He said finding the right balance is what every country is doing. He added, lockdown is a temporary measure in extremes which buys you a bit of time to rearrange your resources. It helps you work things out. That is not what New York City is doing. New York State, California, Pennsylvania. They have their bearings. We have the data. We're still locked down. I think we should be moving beyond having nationwide lockdowns now. If we are going to use movement restrictions, I like them to be local, short-lived, and designed to help the authorities break down a cluster of cases and suppress an outbreak. I think we need to move beyond using lockdown as a primary containment measure. You think? And he goes on to say, I'm not going to suggest that we all shouldn't be traveling. I think we have to work out the risk and also assess whether we would be badly affected if quarantine is suddenly imposed. This comes as the CDC's Dr. Redfield is admitting, we're seeing, sadly, far greater suicides now than we are deaths from CV. We're seeing far greater deaths from drug overdose. What are above excess than we had as background? Then we are seeing deaths from CV. Let that sink in. Even Redfield admits lockdowns are now killing at least 2 times the number of Americans as the CV. These states that are going to court to force their populations to remain in these lockdowns are unconstitutional. They are breaking their citizens' natural rights. Sadly, obviously doing it for political reasons. Which brings me to what I was showing you at the beginning of this video. My initial feeling about Elmhurst and Hart Island and all that crap going on in New York City was that it was all an FF to start this whole thing. And now it's towards the end and I'm still seeing evidence that the whole thing is for political reasons. And if this does turn out to all have been political reasoning, and if this does go away on November 4th after the election, I really hope that the American people don't go back to sleep this time. I hope that this is enough. I hope this is the thing. Because the next thing is going to be a lot worse if we don't say something about these lockdowns. The second we found out that, quote, far greater suicides rather than the CV, as soon as we found that out, we should have been doing a serious reevaluation of these lockdowns. The states that are still in lockdown, what they're doing is a violation of human rights. And the data's in. It's not like we're waiting on the data anymore. Anyways, guys, make sure you guys like, share, sub the channel. If you want to leave me a tip, all the ways that you can do that will be in the comment section below. I love you guys. Later.